In this video, let's discuss one of the poison from this forensic toxicology, that is the cannabis sativa or the indica. And the common name is an Indian hemp, also called ganja or hashish or daga or marjuna, etc. And in India, normally in India and the US, mostly tobacco is used for abuse. After this tobacco, cannabis is the most common substances for the abuse, and this belongs to a family of Cannabinaceae family. And the characteristics is like this plant will it will grow all over India, but its cultivation is restricted by this law. It is a shrub which will grow about 5 to 10 meter 5 to 10 feet in height, and the female plant is very taller, darker and more luxuriant as compared to this male plant. And flowering and fruiting tops are normally used for this preparation, and it include two active principles, that is a cannabinol and a cannabidiol. This cannabinol is not an alkaloid, but it is a fat soluble oleoresin. This cannabinol active form is that delta 9 tetrahydrocannabinol. The resin of this plant contains the active principles, that is both cannabinol and cannabidiol, but normally they are inert. When they get exposed to a heat or the ultraviolet light, they are converted to the active tetrahydrocannabinol isomers. And all the parts of this male and female part of this plant contain these active principles, and this tetrahydrocannabinol acts on the cannabinoid receptors which are present in the brain, that is CB1 and CB2, and then it will inhibit this secondary messenger system in this brain. And this tetrahydrocannabinol is normally metabolized in the liver, and they get excreted in the urine, feces and bile. And these are the normal common preparations of this cannabis, that is the marchuna means just they will dry this flowering tops and leaves, that is the dried leaves and flowering tops. Ganja means they will extract these resinous substances from the female plant. And hashish and the charas means they are taking this resin which is in the form of dry from this flowering tops and leaves and also stems. And hashish oil or the honey oil, it is a viscid liquid which is obtained by unsolvent extraction of resin from the female ganja flowers after this processing. Bhang means it is nothing but a dried leaves or a stem which we are making it into a decoction, it is called bhang. And majun means it is a sweet meat which get extracted from this plant. And sesmilla means it is an seedless marjuna, that is unpollinated female plant. And fatal dose, depending upon which form we are taking, there will be a different forms. That is chara, it is about 2 grams, ganja it is about 8, bhang is about 10 grams per kilo. And if we are taking in the form of tetrahydrocannabinol, it is about 30 grams per kg. And let's say this fatal period, it is about 12 hours to several days. There will be some particular order, that is about smell to that smell will be equal to that burn rope. And the uses of this is, it is an antiemetic which will be used against this nausea and vomiting which is induced by an anti-cancer drug, and also it is used in the treatment of this convulsion, anxiety, pain and inflammation. And in case of acute poisoning, the symptoms will be it will be normally seen in two stages, that is psychological and also physically. Psychologically, it is again divided into two stages, stage of excitement and stage of narcosis. In case of stage of excitement, inhalation is very effective as compared to that ingestion means inhalation means which is breathing through this nose, and ingestion means which is taking through this mouth. means oral cavity. Means this inhalation is very more effective compared to this ingestion. At first there will be a stage of euphoria, means happiness they will be having, and also sense of well-being. Euphoria, this euphoria is associated with the drowsiness and disorientation will be there, and also motor incoordination will be there, and also stimulation of appetite, means more appetite will be there, hunger, they will feel hunger, and tachycardia will be there, conjunctival congestion will be there. When if it is taken in large doses, it will cause nausea, anxiety, confusion, delusion, and hallucinations. And in case of stage of narcosis, there will be a giddiness, ataxia, incoordination, drowsiness, dimness of vision, and also deep sleep will be. And if we see this physical effect, there will be an increased appetite and thirst, paraesthesia will be there, restlessness, and also they will be having an frequent urination. Later there will be a sleep, and with increasing dose the person may go into an coma. Post-mortem changes, it is nothing particular, but there may be having like that of asphyxia, and treatment is by this stomach wash or by any antipsychotic drugs or the psychotherapy we will do the treatment. And in case of chronic poisoning, how it will happens, if we take this drug in small quantities for a long period is not harmful, but it will causes tolerance and psychological dependence. So when we are using this drug in excess, it will causes the degeneration of the CNS and then lead to an insanity. And this chronic use reduces the serum testosterone and also sperm count, and then it is associated with the gynecomastia. And this chronic poisoning mainly shows three important symptoms, that is run amok, motivational syndrome, and Hasish insanity. Run amok means it will develop psychic disturbances which is marked by a period of depression, which is followed by an violent, he will be having an intensity to kill someone, means impulse to murder, that is called run amok. Means it will causes a disturbances psychologically, and so it will be causes a period of depression, and then he will be having an violent impulse to murder someone. And in case of motivational syndrome, it is normally seen in a people who are taking this cannabis for a long period of time, means chronic abusers. They will be becoming lethargic, apathetic, and they will be having no means no interest to do work. They will be having an poor concentration. And hashish insanity means it is also seen in a people who are taking this cannabis for a chronic period of time and heavy abusers. This will causes an paranoid psychosis with violent behavior who are uh, it will causes a homicide or a suicide. And then they will be having an increased susceptibility to pharyngitis, bronchitis, and asthma. And in case of chronic poisoning, treatment is by the gradual withdrawal of this drug, and diazepam we will give for this anxiety, and also we will give antipsychotic drugs or psychotherapy. And medical legal importance is that poisoning is mostly due to taking this drug for a long period of time. Maybe it may be accidental ingestion or maybe inhalation, and normally it is seen like sannyasis and sadhus, they used to abuse this. Majun and charas we will use to stupefy this person who are going to do robbery. And refer joint, it is like it is also one of type of cigar which will contain 0.3 to 0.6 grams of this ganja, which is mainly available in illegal trade market in England and Europe. In India, transport, consumption of this marijuana among other narcotics and psychotropic drugs is a criminal offense which comes under NDPS Act of 1985. I hope you understood. So thank you.